everybody, it's Dr. Aimee, and today I want to talk a little bit about heartworms, heartworm disease, and dogs and cats, okay? So the weather is warming up, it's getting to where the mosquitoes are out, and mosquitoes are actually what carry the baby form of the heartworm. And I don't know how many of you out there know what a heartworm is, but a heartworm is actually a worm that's about this long, probably 2-3 inches long, and it's like a spaghetti, and it lives in the chambers and the large vessels of the heart. So dogs can have anywhere from 4 or 5 or 6 of these guys to 75 or 100. So imagine you got this heart, which is nothing but a big pump, trying to pump blood around this big mass of worms. So what happens? Well, over time it can't pump past those worms, and it works harder and harder and harder, and the heart starts to fail. So the worms themselves are not necessarily damaging the dog, but the worms being in the pipes where the blood flow has to, it's like having a clogged sink. That's basically what's happening, and you're trying to push water past that clog, and for a while you can, but it gets harder and harder until all of a sudden it stops pumping altogether, okay? So mosquitoes carry the baby form. The mosquito bzzz, and it bites your dog or your cat right on the nose or right on the ear where there's not much hair and the skin is thin. It takes a blood meal, so it sticks its little straw-like mouth parts right into a capillary, a small blood vessel, and it's sucking up blood, but at the same time, it's injecting, like a hypodermic needle, the baby form of the heartworm right into the bloodstream. So the heart, the baby forms, they circulate for 6 months, and they go through different life stages until they become an adult heartworm. And we want to stop the process. We want to make sure that the baby form never makes it to the adult form. So it is heartworm prevention awareness time. We need to test your babies if they have not been on a preventative in the last month, 2 months, 3 months. You need to test them. It's just a simple, easy little blood test. Takes about 10 minutes in-house. And if it shows that we don't have any microfilaria, we feel pretty safe to say that they're free of heartworm. What are we looking for when we do a heartworm test? We are looking for a protein that a female worm releases. So where could we have some problems there? If you have nothing but male worms, and so here's the thing with cats, they do get heartworm, guys. I need everyone to know that. Cats are susceptible to heartworms just like dogs, but they have fewer they have fewer heartworms that live in the system. It's usually between 1 and 3 worms, and it is actually the microfilaria, the baby form, traveling through the lungs that injure the kitties, okay? So prevention is everything in the cat, because 1, it's the baby form, which is what the prevention kills, that's doing the damage to the lungs. And 2, if they only have 1 worm, 3 worms, and they're all males, it's not going to show up on a test necessarily. You're going to think your kitty is not infected, while in fact they are, and they're producing more worms, okay? So remember, mosquitoes carry the disease. You cannot contract heartworm. Cats cannot give it to another cat. Dogs cannot give it to another dog. A mosquito has to feed on an infected dog or cat, and then buzz over and feed on your dog or cat, which may not be protected, and that's how they become infected. So, Heartworm 101, get them in, get them tested, get them on prevention. Thank you so much. Have a great day. I know this was exactly what you needed to hear.